Okay, in this video, which is part 2 of our delayed series, we're going to talk about what I consider a true delayed reconstruction, which means doing nothing at your time of your mastectomy and doing all reconstruction months to years later. Now let's first talk about why would someone either have to have delayed reconstruction or choose to have delayed reconstruction? Why couldn't they have just had it at the time of the mastectomy? There's a couple reasons. One are oncologic concerns. If a woman has inflammatory breast cancer or a breast cancer that is very aggressive and we just need to get her done with her mastectomy so she can have some type of adjuvant therapy, it might be recommended to not have reconstruction. That could potentially delay adjuvant therapy if there was a complication. So that's the first thing. The second thing might be maybe the patient is not a candidate to have safe reconstruction. Maybe she's a smoker. Maybe her BMI is too high. Maybe she has other medical comorbidities like diabetes with a high A1C that make it not really safe for her to have reconstruction. The third is just patient choice. There are some women where they just want to have their mastectomy and be done with their cancer treatments and deal with reconstruction later when they're more mentally able to deal with those decisions. Whatever reason you're in the boat that you're in, you now are at a place where you're flat, without breast tissue, and with a questionable amount of excess skin. Some breast surgeons, if they know that you want to have a delayed reconstruction, will actually leave the excess skin because they know it's something that we can expand in the future with tissue expanders. But sometimes they don't leave behind that excess skin unless you specifically address that with them. So you're flat, you probably don't have excess skin. Now we need to think about building a breast. Once again, we need to provide skin covering and we need to provide volume. So you can do that in one stage with a body-based reconstruction, like a DIEP flap. But if you want an implant-based reconstruction, we have to expand the skin somehow. So that involves placing a tissue expander. So now we're at a 2-stage surgery, whereas if you would have had reconstruction at your time of mastectomy, you might have been a candidate for a direct implant reconstruction. The second thing that makes this delayed reconstruction a bit more challenging is if you've had radiation. If you are radiated flat, most women are unable to have their skin expanded to support an implant. I have done it sometimes, but it's definitely more challenging, higher complications, and you can't get to a very large breast size. It's really just a small amount of skin that can be expanded safely. So now we have to provide skin. So now you've bought yourself an autologous reconstruction, a latissimus flap, a DIEP flap, a thigh-based flap. So that can be more challenging. And that's the conversation I have with patients who are considering delayed reconstruction. I say reconstruction can be done at any time, but if you need radiation, you might lose your ability to have purely implant recon.